So welcome everyone to this special webinar presented by the TM Health Professionals Association. It's a very great pleasure to have you all with us. The TM Health Professionals Association is a national organization which provides professional enrichment programs and educational programs for physicians and other health professionals and for the general public in the healthcare applications of the Transcendental Meditation Program. I'm Dr. Stuart Rothenberg, and I'm the director of the association. This is the second webinar in our series of special webinars for health professionals, and the subject of today's webinar is Transcendental Meditation, Stress, and Heart Health. And we're very fortunate today to have as our presenters two leading experts in this area. We'll be hearing today from Dr. Cesar Molina and Dr. Robert Schneider, and I'll just tell you a little bit about them by way of introduction. So Dr. Cesar Molina is a fellow of the American College of Cardiology and a board-certified cardiologist. He received his medical education at the Yale University School of Medicine. And Dr. Molina is the medical director of the South Asian Heart Center at El Camino Hospital in Mountain View, California. He maintains a private practice of cardiology in that area of Silicon Valley, California. Dr. Molina was recently featured in the international edition of CNN discussing non-pharmacological approaches to coronary heart disease. And Dr. Molina has a distinction of being the physician who has referred the greatest number of patients to learn the Transcendental Meditation technique in the US, and he has the largest clinical experience in this area. So it'll be very interesting and informative to hear from Dr. Molina about his experience. Our second presenter will be Dr. Robert Schneider, and Dr. Schneider is also a fellow of the American College of Cardiology. Dr. Schneider is the director of the Institute for Natural Medicine and Prevention, and also the dean of the Marshy College of Perfect Health at Marshy University of Management in Fairfield, Iowa. Dr. Schneider is the most widely published researcher on the research on transcendental meditation and its benefits for health, particularly in the area of cardiovascular disease. And he and his team have received over $24 million in grant support from the National Institutes of Health for research on the TM technique in heart health. So it's a great pleasure. I'm going to first introduce Dr. Molina. Dr. Molina will first speak. He'll be speaking in two segments. First, he's going to introduce the subject of stress and heart health. Then Dr. Schneider will take over and present a solution in terms of the Transcendental Meditation Program. And then Dr. Molina will resume with the discussion of his experience of using the TM program in an active modern medical practice. So I'd like to turn it over to Dr. Molina. Please take it away.
I'm the medical director of the South Asian Heart Center. I'm also the medical director for the Center for Wellness and Achievement in Education. But the information I'm going to show you here today is part of the curriculum that we have developed both for the school program in the San Francisco Bay Area as well as the South Asian Heart Center. The South Asian Heart Center is the first center in the world dedicated to dealing with the epidemic of cardiovascular disease in the world. South Asians tend to have a fourfold higher risk of cardiovascular disease. So as a matter of introduction, I'd like to sort of define for you what we mean by stress. Certain individuals have different definitions of what stress is. Most stress is not conscious. That is, it's obviously when you get a notice from the IRS that you owe them money, that could be a stressful event. But the fact is that physiological stress results from the inability of the physiology to maintain balance, steady state, and or homeostasis. And this, in fact, then is a non-conscious process. It's just issue a physiologic process. This issue of homeostasis is critical in nature. In biology, it's known as homeostasis. In chemistry, it's called a steady state. It's also found in entropy in physics. In the Vedic literature, the enlightened individual is known as a person of steady intellect. So this issue of steadiness, homeostasis, seems critical to health, and it is the way nature works. Now, psychological stress results from the absence of creativity when the individual or organization is challenged. That is, if you have enough creative intelligence to deal with a situation, a change, then it actually becomes a non-stressful event. It is actually a joy. When the creativity or the knowledge is missing, then it becomes psychological stress, or the organization can also then be stressed. That's also known as psychosocial stress. Next slide, please. So this is a nice cartoon describing what we mean by stress and the lack of stress or homeostasis. And that is, the individual goes to sleep, wakes up in the morning, and it's the same individual. There's this continuity of being, this continuity of well-being, while in a stressful situation, next slide, please, what's happening is, and you see this in your practice, you see individuals who are feeling fine one moment and not well the next, and it's this up and down. The blood pressure is normal, the blood pressure is high, the blood pressure is low, blood sugar is high, blood sugar is low, and there's this lack of steadiness. There's this lack of homeostasis. So let's talk about stress and what are the cardiovascular consequences of stress. This is actually comes in from studies done in Europe, particularly in civil workers in the United Kingdom. And in this study, job strain was defined as the combination of high psychological demand and a low degree of control in the work situation. So it's you against the clock and with little control as to sort of how to fulfill your task. Next slide, please. This is actually associated with a 2 to 3-fold increased risk of coronary artery disease over a 14-year period. So that's not 2%, not 3%. We're talking about 200 to 300%. Next slide, please. Now, this is actually a very, very busy slide, and hopefully this will be recorded and you can come back and visit this slide later on. But there is actually a lot of data relating stress and cardiovascular health. So neurotic hostility is actually associated with an increased risk of cardiovascular disease. From the InterHeart trial, which was an international trial looking at 15,000 individuals with heart attack at a young age, compared to another 15,000 individuals without a heart attack, psychosocial stress accounted for 32.5% of the heart attacks. That is, if you eliminated psychosocial stress, you would actually have had a reduction of about a third in heart attacks. We all know about Takotsubo's cardiomyopathy or adrenergic cardiomyopathy, and this is actually mainly seen or commonly seen in Japan, in Japanese men. But I've seen it here in the Bay Area, where emotional stress then precipitates severe reversible left ventricular dysfunction, looking like an LAD occlusion without there being an LAD MI. And actually, they are treated with beta blockers and bed rest and resolution of the stressful stimuli. Dyslipidemia and increased inflammation, as well as metabolic syndrome, have been associated with increased psychosocial stress. And actually, stress-induced obesity is now shown to be mediated by neuropeptide Y. Next slide, please. Now, let's go over emotional triggers of myocardial infarction, and nature permits us to do those experiments. During the Gulf War in 1991, the first Gulf War, where Saddam Hussein was sending missiles to Tel Aviv, there actually, and I remember the Prime Minister going on TV with a face mask. That really sort of, did wonders for the population. There was a 58% increased risk of sudden death and acute MIs during that week at the beginning of the Gulf War. Sporting events, when soccer penalty shots decide a match. This was actually seen in Belgian men, that there was a relative risk of death from a minor stroke that went up by 51% during those penalty shots. Earthquakes. Here in California, we have two earthquakes to compare. The Northridge earthquake in LA, as well as the Loma Prieta earthquake here in the Bay Area. And acute MIs went from 149 the week before the earthquake to 201 the week after the earthquake in LA. Sudden death went up from about 5 per day to 24 the day of the quake. Now, if you show me the next slide, you will see that there was a difference between the Loma Prieta earthquake and the Northridge earthquake. There was no such thing. None of these cardiovascular events happened after the Loma Prieta earthquake in the afternoon, which is sort of a happy time for people. The Northridge earthquake actually started happened on a Monday morning in winter. And we know that Monday mornings tend to be sort of lethal times for acute myocardial infarct. Next slide, please. Now, this is a study that it sort of has amazing consequences, because many times the language in the population actually describes the biology. And many times we hear that someone has been aged by a stressful event. And there's actually a genetic consequence to that, and genetic underpinning to that statement. And chromosomes, at the end of chromosomes, there are little telomeres, and these telomeres contain the DNA that is responsible for helping the chromosome divide and heal itself, or sort of reconstruct itself and maintain its integrity. So they did a study in parents, in particular in mothers of chronically ill children. Being a parent of a chronically ill child with leukemia, is actually very, very stressful. And what they found is that the women who were the most stressed had the shortest telomeres. This actually was published in the Proceedings of the National Academy of Science in 2004, and has been shown to be sort of reproduced in other studies. Interesting, a program of nutrition, exercise, and stress reduction has actually been shown to activate the enzyme telomerase that keeps those telomeres in check, keeps them big. So as you age, for example, the telomeres shrink. That shrinkage also can be precipitated by acute psychosocial stress, and the practice of meditation has been shown to maintain the enzyme, to enhance the enzyme, to keep those telomeres at the appropriate size. Next slide, please. So now we move on to stress reduction. So I just gave you the bad news about the health consequences of stress. But when we talk about stress reduction, and in particular meditation, not all meditations are the same. And I like to use the example of a drug. You can take a medication that can lower your temperature, that can treat your fever, can treat your pain, even though those two medications can both treat fever, can treat arthritic pain. One of them is associated with a reduction in stroke and heart attack, that we call aspirin. The other one is associated with an increased risk of heart attack, and that we call Celebrex, which is now removed from the market by Merck. So not all medications, even though they may share certain things, are the same, and not all meditation techniques are the same. We know some meditation techniques that have that focus on an object. Those are known as concentration techniques. Examples of that are sort of spiritual prayer, rhythmic breathing, repetitive chanting, paying your attention to a candle light. There are contemplative techniques, such as you're observing an object, you're open monitoring. They are also known as mindfulness, Zen meditation, breathing meditation, movement meditation. And then there's auto-transcending or transcendental meditation. Today's in the morning, we're talking about the health benefits of transcendental meditation. The purpose of transcendental meditation is not to concentrate on an object, is not to observe an object. The purpose of it is to lose the object, is to have the subject without an object. And that's what we mean by auto-transcending, where the object of attention is gone and just pure consciousness is left by itself. So if you're conscious of an object and that object resolves and goes away, then pure consciousness is left by itself. In this technique, it's actually a content-free, it's a non-cognitive technique, and uses a meaningless sound or mantra. Next slide, please. So this is actually the EEG pattern, so the different three techniques. There's actually more cognitive control in focused attention or concentration, and less so in open monitoring, and the least in automatic self-transcending. With focused attention, you see gamma waves, and in the EEG, open monitoring, you see a lot more theta waves, and in auto-transcending or transcendental meditation, you see alpha waves. Next slide, please. So this is actually the first paper that was published on the physiology of transcendental meditation. To the right, there is actually this picture that comes from Scientific American that was published a year later, showing a subject participating in the transcendental meditation study, where the investigators defined a wakeful hypometabolic physiologic state. There were 36 subjects, and they showed, next slide, please. Next slide, please. That there was a significant drop in oxygen consumption during the practice of transcendental meditation over this 20-minute period that was associated with a drop in carbon dioxide production, which means that the subjects were not holding their breath, their respiratory quotient did not change, and what indicates that there was a pronounced drop in metabolic rate by about 16%. Next slide, please. This slide actually compares the response, the metabolic response to transcendental meditation with that of sleep. Sleep is associated with about an 8 to 10% drop in metabolic rate after about 5.5 hours of sleep. Hypnosis, in fact, is associated with an increase in the metabolic rate, while the practice of transcendental meditation is associated with a 16% drop in metabolic rate. And this is EEG. This actually comes from the children that we have introduced to transcendental meditation in the San Francisco School District. And these are EEGs where the simple electrodes are placed in the occipital area as well as in the prefrontal area. And you can see that with eyes open, there is a lot of activity, but there seems to be no coordination. Next slide, please. With eyes closed, you can see that in the occipital or visual cortex, there are more alpha waves. Next slide, please. With the practice of the transcendental meditation, the prefrontal cortex just gets online with the rest of the brain, and you can see increased activity that is sort of very similar, and there seems to be greater congruency on the EEG. This is actually part of their curriculum at times. There's a student that is put behind a screen, and the students have to guess what is the student doing. Is the student with his eyes open, eyes closed, or meditating? Next slide, please. Now, I would like to this is the summary of my talk, and I'd like just to leave you with the summary of what we mean by stress. And then Robert will be talking about the fantastic work he has done through the years, looking at the health benefits of the practice of this hypometabolic state of restful alertness. Stress is defined as the inability of the physiology to maintain balance or homeostasis, and as just described here, has great medical and social consequences. But it appears that this hypometabolic state of restful alertness brings about the state of homeostasis, and the bringing about of this state of homeostasis, when everything quiets down, you get to a steady state, has this health consequences that Stuart is now going to introduce as Robert begins this part of this conference. So thank you very much.
So now it'll be a great pleasure to hear from Dr. Robert Schneider. Dr. Schneider, please go ahead.
Yes. Thank you, Dr. Rothenberg, and it's a great pleasure to hear Dr. Molina talk about stress, the physiology of stress, and some basic physiological changes with meditation, particularly transcendental meditation. Now, I'd like to talk about applications to health problems that we see in our offices. And on the screen today, we see the target. This, as you recognize probably, is a coronary artery thrombosis, which could also be a cerebral artery thrombosis. And together, as you know, cardiovascular disease from myocardial and cerebral causes is the #1 cause of death in the United States and the #1 cause of death in the world today. I just got back from a tour in South Asia. You know, Dr. Molina works with South Asians in the United States, and I just was in India and Nepal. And even there, coronary heart disease and cerebral vascular disease are now the #1 causes of death there, as they are in modern westernized societies. So what can we do about this condition? Let's go back into history a little bit and see what the founders of modern medicine have had to say. William Harvey, back in the 1600s, said that every affection of the mind that is attended with pain or pleasure, hope or fear, is the cause of an agitation that extends to the heart. And these sentiments were echoed by William Osler, the founder of Johns Hopkins Medical School and one of the first physicians in the United States in the 1800s. Well, let's go back thousands of years now to the most ancient texts in the world, who the texts and knowledge has been with us as long as history goes, to the Ayurvedic text. This is from Charak Samhita, the major text of Ayurveda, talking about the brain-heart connection. And this says, one who wants to protect the heart, great vessels, and ojas. Ojas is sort of the life-giving fluid of the body, should particularly avoid afflictions of the mind. And he should regularly take measures which are conducive to heart and ojas and cleansing of shrotas, or the channels or blood vessels, and make efforts for serenity of mind and knowledge. So both Charak from thousands and thousands of years ago, when William Harvey and Dr. Osler and Dr. Cesar Molina agree that the mind and brain have something to do with the heart in terms of the stress connection. And what we're going to suggest to you and what we're going to elaborate on today is that that brain-heart connection can be used positively to create increases in heart health. This has been one of the main themes of research of our center for the past 25 years. And we and colleagues around the country and around the world and collaborators have systematically evaluated the effects of the brain-heart connection on the cardiovascular disease process, looking at all the major risk factors for heart disease. These are all the modifiable risk factors for heart disease. And we just heard a review of the data by Dr. Molina showing that psychosocial stress is as potent a risk factor for heart disease as high blood pressure, hypercholesterolemia, smoking, diabetes. And furthermore, psychosocial stress contributes to all the other risk factors. Furthermore, Dr. Molina quite wisely and broadly pointed out that stress in the environment, if we're in an area of warfare or economic distress or geographic stress, also contributes to disease of the arteries. And that these risk factors contribute to clinical disease, healthcare utilization, healthcare costs, very relevant to contemporary society, Medicare, and all payers of healthcare. And then, actually, this is not saying that paying your healthcare bills contributes to mortality, although sometimes it can feel that way, but clinical morbidity leads to mortality. So we looked at this whole range of pathophysiology and on the intervention, potential intervention with transcendental meditation in this process. There have been 10 randomized controlled trials published now in excellent peer-reviewed journals on effects of transcendental meditation on blood pressure. And a recent meta-analysis was conducted at the University of Kentucky, looking at the combined effects of meditation compared to controls on blood pressure. And according to these meta-analyses, reductions across the 10 trials, 1,000 patients were about 5 millimeters for systolic pressure, about half that, 3 or 4 millimeters for diastolic pressure. These changes are greater than average changes with other lifestyle modifications that all of us recommend already. When you look at the meta-analyses for exercise, weight loss, and sodium restriction, the average reductions of blood pressure are similar to or less than these effects from mind-body intervention alone. And furthermore, these effects may be additive to other lifestyle interventions. This is another meta-analysis that looked at the entire literature on stress-reducing methods, various relaxation methods, stress management, biofeedback, combination treatments, and transcendental meditation. This meta-analysis looked at all the well-designed and replicated randomized controlled trials. So we've all heard case reports, case series, uncontrolled studies on a host of mind-body interventions. A lot of people have their favorite intervention, and you'll hear a lot of your colleagues or our colleagues saying, well, let's just do something, it doesn't really matter. But when you look at the data, and modern physicians, modern medicine prides itself in being evidence-based. So when you look at the strong studies on mind-body interventions, muscle relaxation, stress management, biofeedback, and combination treatments have no significant effect on reducing blood pressure. However, when those same trials that I showed you in the previous slide are added to this meta-analysis, the results continue to be significant, whereas the others are just not. I want to mention before I get into this slide that there's another study on medication use. So we found that patients who are using antihypertensive medications who learn the transcendental meditation technique in the context of a randomized controlled trial had about a 20 or 25% reduction in medication usage over a year's time. So clinically, that means you can recommend your patients who are already taking antihypertensive medications to start TM, and if their results are along the lines of the average, of course it could be greater than the average or less than the average, but they should have reductions, or often will have reductions in their needs for antihypertensive medications that go along with the reduced blood pressure using natural methods of homeostasis that Dr. Molina talked about. This study now on the screen is a trial of blood pressure in university students, but here we looked at psychological correlates of stress. The blood pressure was a physiological correlate. We wanted to look at simultaneous psychological correlates. In this trial, the students who were randomized to transcendental meditation had reductions in anxiety, depression, anger, and hostility, as well as increases in coping ability by standardized measures of psychological stress and reduction in total distress. And so these changes in mind or psychology were associated with changes in physiology or blood pressure. So brain-heart connection quite well illustrated there. This is a trial on insulin resistance in heart disease patients at Cedars-Sinai Medical Center in Los Angeles. This trial was funded by the National Heart, Lung, and Blood Institute and published in the Archives, which is now called JAMA Internal Medicine, one of the JAMA journals. In this trial, we looked at glucose-insulin ratios as a measure of insulin resistance, which may be the central pathogenic mechanism of diabetes, metabolic syndrome, and a lot of people suggest is central to atherosclerosis. And in this trial, over 16 weeks, heart disease patients practicing transcendental meditation had a significant reduction in their resistance to insulin, which is positive, whereas the controls had a relative increase in their glucose-insulin ratios or resistance to insulin. So all your patients with type 2 diabetes, your patients with obesity, your patients with metabolic syndrome, they can probably benefit from this practice due to changes in neurohormones like cortisol and catecholamines. This in turn could be a mechanism for changes in insulin and glucose regulation. Talking about obesity, this is a study done by Dr. Barnes and colleagues at the Medical College of Georgia, now published, on body mass index, or body mass, in adolescents. These are teenagers who practice transcendental meditation in their schools. Like in San Francisco, there are many schools, 100,000 students in North and South America, now practicing transcendental meditation as part of their curriculum. And in these students, when they meditated twice a day for a semester or 3 months, there was a relative reduction in body mass compared to the controls in red. So there's a prevention of weight gain in these obese or other high-risk African Americans, many of them with metabolic syndrome. So given that 2/3 of the American population is overweight or obese, here's a technique that could help deal with the biochemistry of obesity, metabolic syndrome, all related to diabetes and ultimately atherosclerosis. This is the seminal trial conducted by Dr. John Zamora and colleagues at the Buffalo VA Hospital, done in the 1980s, published in the 1990s, where a group of heart disease patients who are waiting for bypass surgery decided to enroll in this trial of TM compared to control. And then Dr. Zamora ran them on the treadmill before and after about 8 months' time and looked at their exercise duration, maximum workload, and onset of ST depression. So the experimentals had improvements in exercise duration, significant improvements in workload, and significant decrease delay of onset of ST changes on the EKG. So there were electrocardiographic and functional evidences for improvements in myocardial ischemia, stress-induced myocardial ischemia, with practice of meditation alone added on to conventional care, conventional medical care, without intervention or revascularization in these patients. About 10 years later, we conducted a trial on atherosclerosis measured by carotid intima media thickness. This was done at King Drew Medical Center in South Central Los Angeles, funded by the National Heart, Lung, and Blood Institute. This was about 100 patients with hypertension who were randomized to TM or a health education class, which was matched for time and attention and expectancy, published in Stroke by the American Heart Association. And as you can see in this graph, the experimental group had a reduction in carotid IMT. So essentially, their carotid walls got thinner, their carotid lumens got wider. This is a regression of atherosclerosis, which mirrors coronary disease and cerebral disease. This is the first time that it was shown that a mind-body intervention alone could regress atherosclerosis without changes in diet, exercise, or drugs. Not to say that those lifestyle changes don't have effects, they certainly do, but this is showing the mind-body intervention alone. Consciousness changing physiology. Fast forward another 10 years, 2 months ago, there was the latest and greatest trial published in Circulation, one of the circulation journals from the American Heart Association, a trial sponsored by the National Institutes of Health. Took us 10 years to do it. It was done at the Medical College of Wisconsin in Milwaukee. Here are the methods. This is, anyway, so you can judge for yourself. We believe it's the best trial ever on TM and heart disease. 200 subjects, male and female, 60 years old, African Americans, all with coronary artery disease documented by coronary angiography with significant stenoses in at least one artery, randomly allocated to transcendental meditation or an education control, matched for non-specific factors, all continued usual medical care, standard medications that you prescribe in your practices, followed for an average of 5 years. Primary outcome, heart events, death, heart attack, and stroke was the composite primary outcome. Hard to argue with those clinical events. Here are the results. This is a representation of the survival curve. This shows event-free survival over an average of 5 years in the health education group, in the control group, health education and the meditation group. The meditation group had a 48% lower rate of death, heart attack, and stroke, which was statistically significant. This is a breakthrough. Statins have about a 30% average reduction in clinical events. Same events. Antihypertensive medications, 25% reduction in hard clinical events. Antithrombotic agents on that order of magnitude, aspirin. This is as large or larger than any known drug. However, all these subjects were taking those drugs already because they were all receiving usual medical care. So this is like the discovery of a whole new class of medications for the prevention of atherosclerotic cardiovascular disease. This class of medication was not exogenous. This is like discovering an endogenous drug, whether it's endorphins, whether it's a nitric oxide active agent. We don't know what the biochemistry is. Certainly, this is a way to turn it on and related to those changes in risk factors and basic science changes, presumably that we heard earlier. Summary of those findings, along with reduction in disease events, there's a reduced blood pressure maintained over 5 years in these subjects with heart disease. There was reduced psychological stress, notably anger, and there was a correlation between regularity of TM practice and survival. So there's a dose-response effect. Those who didn't practice didn't have an effect. This has hit the news. This is the first report, came out at the AHA conference prior to the publication, but New York Times had a headline article, "Can meditation curb heart attacks?" The answer from the article was yes. This got hundreds of media hits in its reports. Big news, the whole New York Times article there. Now I wanted to talk to you about some new frontiers. That was 2 months ago. The next frontier this month is looking at other stress-related disorders. Post-traumatic stress disorder is an epidemic in the military, U.S. military these days, as well as many civilian populations. Nearly 20% of active duty U.S. military personnel and returning new veterans suffer from this disorder, and it's a risk factor for cardiovascular disease. These vets have greater hypertension and die sooner and higher rates from coronary thromboses and cerebrovascular disease. So it's a big problem, and we've recently received a grant along with our colleagues at a large VA hospital for a 5-year trial on the effects of transcendental meditation on post-traumatic stress disorder. That trial is just starting now, but there is preliminary data from Dr. Jim Brooks' study from Colorado and Dr. Norman Rosenthal's published case series recently suggesting major effects on this stress-related disorder, which would affect mental health and physical health. Very relevant for our young men and women returning from the service. This research and other research on other aspects of Maharishi Ayurveda are reviewed in a popular book. It's suitable for your use and also for your patients. It lays it all out in readable, popular language, lots of illustrations about transcendental meditation and Maharishi Ayurveda for reducing stress, controlling blood pressure, cholesterol, weight, diabetes, and heart disease, available at all the usual booksellers. Now I want to close this with reminding you how this all happens. We've talked a lot about physiology and physiology of stress and physiology of heart disease today, but I'd like to remind you of the Vedic perspective, Maharishi's perspective, that he wanted us to remember about how all this works. On the left is a representation of human physiology. Here's an individual, organ systems made up of organs. Organs are made up of tissues, cells, cell components, macromolecular systems, ultimately proteins, guided by RNA, guided by DNA. So from this systems biology perspective, the whole body is made from the intelligence contained in the DNA. And DNA, after all, is a biomolecule governed by the laws of biochemistry, ultimately laws of chemistry, ultimate laws of physics. This, on the bottom of the chart, represents the laws of physics. Quantum physics talks about 3 basic constituents of matter and energy, the matter fields, energy fields, and force fields, and a field that relates force and matter fields called supersymmetry. These 3 basic quantum mechanical forces, according to predictions of Einstein and string theory and modern physics, have their basis in a single unified field theorized by modern physics and described by the Vedic and Ayurvedic tradition as one's own inner self, or Atma, or pure consciousness. And during transcendental meditation, what we do is allow the thinking mind to become more quiet, less active, less bounded in the normal waking state thinking, until we experience an unbounded state of pure, undifferentiated awareness, which can be said to be a unified field on the level of consciousness, described by Vedic or Ayurvedic science as the same unified field at the basis of mind and body, confirmed or validated by modern science, because when we transcend during meditation, what happens to the body? That's what we just spent the last 40 minutes reviewing. Changes in physiology, cardiovascular physiology, and there's new data that we're publishing soon, but I'll give you a hint, showing that transcending changes gene expression, telomerase gene expression actually. So we're changing DNA through transcending, supports this mind-body connection on the level of the unified field. The body's own inner intelligence, from a larger perspective, same intelligence that governs all the laws of nature in the universe, universal intelligence contained in our physiology. That, from the Vedic perspective, is what we're doing during transcendental meditation. That affects the individual, and through the collective consciousness effect, has effect on environmental stress, which we talked about today is also important for heart disease. Got to reduce stress in society. got to reduce stress actually in the whole environment because that feeds back on the individual. So this is a technique for individual stress reduction. And although we didn't review it much today, there are 20 controlled studies on this technique's effects on environmental stress and related health conditions. So with that, I want to leave you with the big picture and theory and practice and experimental confirmations of this Vedic approach to health with the Transcendental Meditation Program. So thank you very much.
Oh, Dr. Schneider, thank you so much for that absolutely brilliant review in such a short period of this enormous field and your groundbreaking work. You know, I think it's clear to all of us that when the history of this period is written and we look back on this, that we're going to see that your contribution was absolutely enormous in creating this paradigm shift where we truly understand the power of the mind and the pharmacy within to create healing in, and especially in this number one health problem in the Western world, cardiovascular disease. So please know that we all so much appreciate all the work that you've done over all these years. All of us stand on your shoulders in this way, and please keep it up. And we look forward to even greater and greater findings as you continue this great work. So now I want to invite Dr. Molina to come back. And I mentioned that Dr. Molina has referred more individuals to learn the Transcendental Meditation technique than any physician in the United States. He has actually integrated this successfully into his very, very busy cardiology office practice. And so, Dr. Molina, we are really looking forward to hearing from you how you've managed to do this, how you set this up, and how you follow these patients. So please go ahead. And everyone else, please mute your mic so we'll be able to.
Well, in summary, I use Transcendental Meditation in my practice like any other technique that we have available. And what I mean by that is when I see a patient that may benefit from the practice, just like I would see someone who needs to have a colonoscopy or needs to see a neurologist, on my referral exit paper, I just write, please arrange for the patient to meet with a TM teacher. And in my office, the TM teachers meet my patients and we make appointments for them, like we make an appointment for an echocardiogram or a stress test or for a coronary arteriogram. They get reminders by text messages and emails and phone calls to make their appointment. They come, meet with the TM teacher, make arrangements to learn. And most recently, and that is sort of fluid and changing, many of my patients were learning how to meditate in my office, and they were subsequently meeting with the TM teacher at the office and going through the course at the office. There was a period of time where TM was being billed to their insurance companies, and we were being reimbursed for the services provided at the office. But what I'd like to do is to give you a little bit of an introduction on how it all started in my practice. And I have been a practitioner of the technique since I graduated from high school in 1972. I was 18 years old. He had a pronounced effect, and I went from being a B+, A- student in high school to graduating as a scholar of the college, and then, having a very relatively easy life after that, for which I'm very grateful. And but I was not using the technique in my practice until about 1991, 1992. At that time, I had a patient that had done multiple coronary artery interventions, and he was a bioengineer from the Valley, an intelligent man, but the more I saw him in the practice, the higher his blood pressure went. And I was sort of adding medication after medication, and then I realized that what had happened was that he had lost his sense of well-being, that the diagnosis of coronary artery disease and my intervention had led to a loss of well-being. So I asked him, why don't you look up in the telephone directory? This is before you could sort of, search in Google for transcendental meditation and look for that. And he did. And he learned how to meditate. I had no contact with the TM teachers here in the San Francisco Bay Area. And he came back to the office and his blood pressure normalized. And then I slowly removed many, if not all, of his antihypertensive medications. And one of the things that you will notice as you review the literature that is being very consistent in the literature on transcendental meditation is that TM is associated with a drop in the blood pressure. That's been shown in every single study. And then the second patient was someone who also, again, here in Silicon Valley, shows up in the emergency room with an anterior wall myocardial infarction. And I wanted to do an emergency angioplasty, and he did not want to. So I instead gave him a thrombolytic agent. We at El Camino Hospital have been accustomed of just doing primary intervention in the setting of an acute MI. But we gave him, in that date, streptokinase. He dissolved his LAD clot. I cath him 2 days later, and actually there was no residual obstruction. There was no more than a 12% narrowing there, so we did not have to do an intervention. And then the patient actually was hypertensive. And again, I said, I would like you to take these medications for your high blood pressure. And he said, I don't want to take medications for high blood pressure. So I said, well, why don't you look at this transcendental meditation in the telephone directory, and maybe you could do this, and it may obviate the need for antihypertensive medication, which he did. And he learned how to meditate. His blood pressure normalized, his EKG normalized. And after that second patient was referred to the meditation center here, I got a call from the meditation teacher at that time, John Black, now Raja John Bright. And we started referring patients to learn how to meditate. So in the cath lab, whenever I finish an intervention, I would tell the patient, well, these are the 4 things you need to do to avoid becoming a frequent flyer to the cath lab. Because in those days, you'd had one intervention and you had to, it was like every 3 months you would need an intervention. This is before the widespread use of stents, which have changed that somewhat, but it's still happening. So I told him, well, you need to follow a nutritional plan, and a very simple nutritional plan. You need to exercise. We'll send you to the cardiac rehab program at El Camino Hospital. You need to take your medications, and you need to do meditation. And it's sort of amazing, you have the patient there, you just finish opening up an occluded artery, you say their lives in their eyes, and just do whatever you tell them to do. And I have about 200 patients subsequently learn how to meditate, many of them in that way. And I can tell you now that, most of them, I think actually none of them have actually had to go back to the cath lab to have another coronary artery intervention. So on that basis is how we use it in our practice. We practice science-based medicine. I don't see many people who are interested in alternative medicine. In fact, those who are interested in alternative medicine, they tend not to, in my practice, they tend not to do what I tell them to do. I actually prefer the common, normal person who just, watches football games on Sundays and have a couple of brewskis. And I just tell them, take these medicines, do this exercise, eat this diet, and learn this meditation. And they just sign up, follow through, and do it, and they never come back to the cath lab. So this is how we do it. There's really no magic behind it. It's just behaving towards it, just like behave towards it for another pill or another intervention that we do in interventional cardiology and preventive medicine cardiology, which we're now practicing more and more. In fact, what is happening is I'm sort of running myself out of the market. That is, the more and more I do this, the fewer interventions I have to do. And now I think I do more angiograms for critical aortic stenosis than I do for coronary artery disease. So I'd like to sort of, if you have any questions, I'd love to sort of answer and, have a little bit of a dialogue with you. I'm sure Robert would like to come back on, as well as Stuart.
Well, thank you. Thank you, Cesar, for sharing your experience with us. I think what's most impressive is you have taken the ball and run with it. You're one of dozens of physicians around the country who have done it, but I think you've blazed the trail and you really show us the way it should be done. At a recent presentation that we had here in Washington, D.C., was featuring Dr. Norman Rosenthal and two local psychotherapists, also for health professionals. One of the psychotherapists said, looking at this data, and she said particularly with respect to cardiovascular disease, even though she was a psychotherapist, she said, I think it's actually malpractice for a physician to have a patient with cardiovascular disease or any psychological problem and not refer them to learn transcendental meditation. And she, made that dramatic statement. And I think this is the assumption that you've had. You treat TM as a modality, like you said, your staff refers them for the appointment to learn TM just like they would for an echocardiogram, for a stress test. Your office follows up with them, make sure that they kept the appointment. You even have the TM teachers come into the office and do the introductory lecture, and at times even do the teaching there. So what you're showing us is that you're doing justice to the research that Dr. Schneider has presented, which shows us that this is a very powerful technology, certainly as powerful, the data suggests, as the conventional drugs that are being used, and even more so because it adds on additional cardioprotective effect. And we all should be taking this as seriously as you have and set up these systems in our offices to make this very automatic, that our patients can easily access the instruction in the TM program. So I really want to congratulate you and thank you so very much for showing us how this really should be done. And I want to mention to the healthcare practitioners who are on the webinar that, and remind you, because I think many of you know this, that we have a very wonderful new program that helps you refer your patients and clients to learn the Transcendental Meditation technique, and this is called the Physician Affiliate Courtesy Program. But it's not only available to physicians, it's available to basically all licensed healthcare practitioners who see patients and are legally entitled to recommend treatments and therapies for them. And this PACP, or Physician Affiliate Courtesy Program, enables you to refer your patients or clients for instruction in the TM technique at a significantly reduced professional courtesy fee. So whereas the usual standard adult fee for instruction in the technique, and including the lifetime follow-up program for TM, is $1,500, for the professional courtesy fee, it's $1,020. So it's about a 1/3 discount on the standard fee. And and this is available also to your colleagues, your non-meditating colleagues, who you may want to suggest that they learn the TM technique as well, and then they can in turn refer their patients for instruction. And all you have to do, if you're not already set up for this, is just send us an email or give us a call, and if Paul, you can show that slide, that last slide that gives the contact information. It's coming. And so just give us a call or send us an email to healthprofessionals@tm.org, or call the toll-free number that's listed here, 877-540-6222, or you can do this through our TM Health Professionals website. The URL is listed there. And you can enroll in any of those three ways for the PACP so that you can refer your patients for the reduced professional courtesy rate. Also, we are very happy to provide you with brochures, what we call the doctor's office brochure, which is entitled Why Doctors Recommend the Transcendental Meditation Program. And there's a new insert that goes into that brochure which explains to your patient that reduced fees for instruction in TM are available if their doctor, namely you, recommends it to them. So that's a very nice way. You hand that to your patients, and we also will provide you with display stands that you can keep in your office and to display these brochures, and you can have them around the office in your desk and just give them to patients who you feel instruction in TM will be helpful. Okay, I also wanted to mention at the bottom of this slide the newly updated course on Transcendental Meditation and Heart Health, which you can find at www.tm-heart.org. This is a beautiful course that reviews all of the data that's been presented today and more. And this was developed by Dr. Serena Grosswald, an expert in medical education, along with Dr. Schneider, Dr. Molina, and our other experts in cardiology. This course was, an older version of it, approved for Category 1 CME credit for 1 hour. At the moment it's not, but we anticipate that it will be again, and we think that should be within a few months it'll again be accredited for Category 1 CME credit. I think this would be a good time to close our conference. So I want to again thank so much Dr. Cesar Molina, Dr. Robert Schneider. Both of you are such inspiring leaders in this field of using transcendental meditation and the power of the mind to create heart health. And your presentations were beautifully complementary. I think it was just lovely to hear Dr. Schneider as a pioneer, groundbreaking researcher in promoting this phase transition and the understanding of TM, and Dr. Molina being the great pioneer in implementing this in practical practice and really showing us the way to do this effectively. So thank you all once again for joining us.